COVID-19 making headlines. Stroke awareness is critical. Perhaps now more than ever, no one should ignore the signs of a stroke for fear of COVID-19 exposure at the hospital. And here to tell us more over video chat is Carle neurosurgeon Dr. Miranpuri. Thank you so much for being here this morning.
Hi, good morning.
Good morning. So first and foremost, let's talk about what a stroke is.
Yeah, so the majority of strokes that we see, roughly 80 to 85%, they occur because there's a blockage of blood flow to a particular part of the brain. And so that part of the brain is not getting essential nutrients and oxygen that it needs. Another form of stroke that we see, roughly 15 to 20% of the time, is due to a leaking or burst blood vessel in the brain.
So what causes a stroke?
So, there's different risk factors that people can have. A lot of what we see is patients who have plaque buildup in the vessels in their neck. They might have an irregular heartbeat that causes a clot to form, and that clot gets lodged in the brain vessel.
And doctor, what are some challenges that people could face when they have a stroke?
So stroke is the #1 cause of disability in the United States compared to any other disease or illness. And so, strokes, they leave patients feeling that they've lost all their independence. And the symptoms that you experience with a stroke, it depends on what part of the brain is suffering from the stroke. So the most common things that we think of would be difficulty with walking, getting the right words out together to form a sentence. Your peripheral vision might be impaired, but even daily simple activities that we take for granted, like cooking, brushing your teeth, shaving your beard. And then there's some even more subtle things that patients might experience that others around them don't really, may not pay attention to, such as their concentration being off, having a hard time remembering things, or just feeling frustrated and anxious because of the limitations that they're having from the stroke.
And Dr. Carle is actually a comprehensive stroke center. Can you talk about the difference between that and a primary stroke center?
Yeah, so last year, Carle became a comprehensive stroke center, and we're the only one in the region. So this is really exciting for us here in town, as well as the region that we serve. So comprehensive stroke center certification recognizes hospitals that meet a very high standard to treat the most complex stroke cases. So through this rigorous certification, there's this surveying, accrediting body that comes out to the hospital and does an independent review of the hospital to ensure that we have 24 hours a day, 7 days a week, all year long, all the equipment, resources, physicians to be able to handle these complex strokes.
Wow, that's pretty impressive and reassuring for our community members, I'm sure. So what does that complete range of stroke services so close to home really mean for our community?
So being able to handle the most complex strokes here in town means that patients and their families, they're getting the same level of care that they would get going to a comprehensive stroke center in a big city like Chicago or St. Louis. And the treatment and rehabilitation after a stroke, it takes weeks to weeks, days to weeks to months sometimes. And so keeping these patients and their families close to home is key.
It is key. And I know you guys have an acronym when remembering if you think you are having a stroke. So can you talk about FAST and what that is?
Yeah, so FAST is one that a lot of people in the community are aware of by now. There's another one that recently has been going around called Be Fast. So, a lot of people being at home right now because of COVID really want people to think about this and talk about this at dinner time. So Be Fast, B is for balance. So difficulty with coordination, walking, or dizziness. E is for eyes. So having difficulty with how clearly you can see or having difficulty with your peripheral vision. F is for face. So if you have a sudden drooping of one side of the face. A is for arm, so sudden weakness or numbness, tingling of one of the arms. S is for speech, where patients may experience slurring of their speech or having a hard time putting words together. And T is for time. So that means time to call 911 and get help. And, as May is Stroke Month, it's Stroke Awareness Month, we really want to get that awareness out there in the community. And so a lot of people, they're fearing COVID-19, rightfully so. But the key is we want to make sure that people are getting immediate medical attention if they're experiencing these symptoms. And so please remember that treatment for stroke is time sensitive. So the longer patients are having these symptoms and they're not seeking medical attention, the less treatment options we have. And our ambulance providers and staff in the hospital, they're using the highest precautions to reduce the spread of coronavirus. So we don't want patients living in fear of coming to the hospital.
Most definitely, because that is key. So finally, doctor, is there anything that we can do to reduce our risk of a stroke?
Absolutely. So there's lifestyle changes that, we really want to encourage patients to think about. So low salt diet, more fruits and vegetables, whole grains, getting up, moving around, being active. And if you're smoking or drinking alcohol, you really want to get those out of your daily routine. And then also reducing your risk factors. So, there's a common theme between patients who have strokes and heart disease, and that is high cholesterol, high blood pressure, diabetes, heart disease, and obesity. So we want to work on all of those things as well.
Doctor, very informative. Thank you so much for joining us this morning. We appreciate your time.
Thanks for having me.